Well, hi there, everyone. This is Dr. Laura Ross, for anyone who doesn't know her. Amazing pelvic physical therapist, as well as a sex counselor. So this is, I think, our fourth installment of Bedroom Banter, maybe our fifth, on sex and aging. And I'm going to let Laura take it away.
All right. Hey, everybody. Thank you so much for joining us. And I think this presentation will also be recorded. So if you're joining us after the fact, welcome. So today we're going to talk about sex and aging. This is one of my favorite topics to talk about, and I really love to work with folks of all ages on having a healthy sexual life. So I often tell people that I work with people from, age like 18 to 20, all the way up through people their 80s and 90s. And so when we're talking about sex and aging, it could really happen anywhere along your aging journey because every decade is a little bit different. So when you're thinking about aging, it's a pretty wide spectrum of folks. All right. Oops. All right. So here's some facts about sex and aging. Um, so being sexually active is strongly correlated with better health among older cisgender men. I think there was another slide before this that I wanted to hit to. There we go. So before we get started, I just wanted to ask a question. So the question is, what do you think of when you think of sex and aging? And so a lot of times people have more negative things to think about. So maybe you're thinking about, oh, I think about pain when I'm thinking about sex. Generally, I think when we age, we're supposed to have lower energy. Maybe we're thinking about like there's a loss of interest in sex. It's kind of like I've been there, done that. It's not really important to me anymore. Maybe it's too much effort. Or maybe it might even feel a little gross, like you don't want to be that dirty old man or dirty old person. And so those are a lot of kind of sexual scripts that we have in our society, which is a generally aging averse society, doesn't leave a lot of space for aging. And so I want to try to bust some of those myths today. All right. So again, being sexually active is actually correlated with better health among older cisgender men. For cisgender women, it's primarily related to partner availability. And we know that for cis men from ages 57 to 64, about 84% report that they're sexually active. And that number goes down to 39% in folks 75 to 85. Change that there. In cisgender women, age 57 to 64, 62% are sexually active, and that number dips to 17% in folks that are 75 to 85. And the highest prevalence of what we call distressing problems, so that would be like desire issues, arousal issues, orgasm dysfunction, or pain, is in women aged 45 to 64. And we know that heterosexual older women are more likely to be sexually active than older lesbians and bisexual women, 64 to 44% in this particular study. But we also know that self-rated successful aging was strongly correlated with sexual desire and sexual activity, sexual enjoyment and sexual satisfaction, and participation in sexual activity of any kind. So when you want to have some successful aging, sex is actually part of that. And sexual activity actually improves health. So it increases endorphins and testosterone for everyone. It helps to reduce inflammation. It is an increased physical activity. It's a greater enjoyment of life. It even improves sleep quality and can potentially reduce depressive symptoms. And there's also evidence of decreased frailty in folks that remain sexually active, which is also pretty neat. Couple other things to consider with aging is the prevalence of STIs or sexually transmitted infections. A 2018 study noted that 17% of new HIV infections in the United States were among adults age 50 and over. And in general, there's lower rates of STI testing in this population. And so I'm always encouraging clients to learn to have the conversation with new partners. Of course, when the fear of pregnancy is no longer present, it might be that STIs are a little farther from your mind, but they can still occur and are highly prevalent in folks over the age of 50. And so it's just a good opportunity to think about safety and communication with partners. So what are some of the barriers to sex and aging? Well, there's some health related factors. So, high blood pressure, diabetes, and other chronic health conditions can certainly affect sexual activity. We know that cardiovascular health in particular is implicated in erectile dysfunction for people with penises, as well as in arousal dysfunction for people with clitorises. Diabetes and high blood pressure are also correlated with blood flow. And what do we need for arousal in the genitals but good blood flow? So if you have a chronic condition that prevents good blood flow, that can affect things. Other chronic health conditions can impact sensation, can impact mobility, can impact pain. And so managing regular overall health can be really helpful. There can also be side effects of common medications. And so we could be talking about SSRIs or potentially oncology treatments can cause sexual side effects. There's also a decreased mood that can be a health factor. So maybe some anxiety and depression. Really commonly, we see orthopedic pain or potentially arthritis. So if your hip and your back are painful, if you need a hip replacement, or if you have spinal stenosis or arthritis, getting into positions that feel comfortable and engaging in sexual activity can be challenging sometimes. Other factors include fatigue and something called sarcopenia, which is normal age-related weakness in our muscles. And then in general, our blood circulation slows down. Diet and exercise habits are also huge. Having good mobility, good muscular endurance, and strength are huge factors in having a good sexual activity. But things like alcohol consumption and even protein consumption can affect how we have sex. Finally, memory disorders and dementia can also affect our ability to have consent, our ability to be present, and lots of different factors. And that shows up in a lot of different ways for folks as we age. There are also physical changes. And so physical changes for vulva owners are mostly related to menopause, although I should say that some of these things can start to occur in perimenopause, and perimenopause can be, 10 to 15 years of a symptom experience and can start in your mid 30s. But more commonly, we see menopause happening in the early to mid 50s. Um, and so a lot of this, it's hard to separate the effects of aging alone versus some of the effects of menopause. But one of the things we see is a decline in sex hormones. And so this can change physical, emotional, and cognitive responses to sex. And it's not just estrogen. So estrogen and testosterone decrease. There's also the genitourinary symptoms of menopause. So this is where we get what we call vulvovaginal atrophy. So dryness, pain. There can also be urinary urgency, leakage, or pelvic floor issues. And there can also be labial resorption, which means the inner labia actually gets smaller or potentially disappears as a result of less estrogen. There can also be distressing low desire. And so this is multifactorial, of course. It could be hormonal, situational, relational, and dependent on sexual enjoyment. And so I think a lot of times we think that low desire has to do only with physical factors, when in actuality, you want to ask, is this a desire problem or do you just not like the sex that you're having? Um, the decrease in testosterone that is normal in menopause can also cause reduced libido and sexual fantasy. It can cause a decreased sensitivity in our erogenous zones. It can lead to an increased time to arousal, decreased intensity of orgasm, potentially a lack of concentration or brain fog that can, prevent you from being really in the moment during sex. And fatigue can also be a factor there. Physical changes for penis owners are also related to a decrease in testosterone. So this can lead to a lengthened sexual arousal and time to orgasm. And so it's really important in these cases to manage our expectations to minimize disappointment. So things just might take a little bit longer. Erections tend to require more physical stimulation to achieve or maintain, and erections are less frequent and long lasting. So you might notice less morning erections or fewer erections throughout the night as well. There's also a decline in both erectile rigidity and ejaculatory volume, which is normal. And there's also an increased refractory period in between bouts of sexual activity. Erectile difficulties are one thing, but none of the things that I listed in that testosterone thing are related to sensation. And so I think we consider for people with penises that the most important part of their sexual activity is the penis, but there's so many possibilities for sensation and having a good time and doing things that feel good that have nothing to do with an erect penis. But we know that erectile difficulties are the most common reason older men cease having sexual activity because, it's a persistent ability to attain and maintain a penile erection that's or sufficient enough for intercourse. And this can be associated with lots of different things, not just the physical. So, with relationship problems, psychosocial stressors, a loss of self confidence, a loss of desire. And there's a huge societal imperative here in the United States about erections and masculinity and one's value as a man based on the erection. And so, one of the things I like to do with clients is work to examine some of those feelings because you can still be a fully sexual self, even with erections that are not the same as they once were. Some of the social barriers that we might find are related to housing. And so, if folks are living in a long term care facility, or even before that time, if they're in a communal living situation, like maybe they're moving in with a child and grandchildren to help with caregiving, things like that, that can limit, the ability to have privacy or the space you need to have sex. There's also a stigma about older folks and sex. So, think about that first slide where we asked some questions about that. There can also be caregiving responsibilities. So that could be for a spouse, a parent, a child, a grandchild. And it's really hard to tap into your sexual self when you're in caregiver mode. Body image challenges are also a challenge for all genders of folks in this period. So our bodies all change with age, whether that's skin changes, muscular changes, hair changes, all sorts of different things. And that can prove challenging for one's body image when you are naked during sexual activity. Stress is another huge factor. So we know that folks are often at the height of their career in middle age and older, and so a lot of stress develops there as well. Sexual scripts and our cultural beliefs can also have a profound effect on our sexual lives. And so that could mean stuff that you learned about as a kid, following you into adulthood and older adulthood, leading for you to be limited in your sexual beliefs. About whose role is what in sexual activity is another frequent sexual script I hear about in my older clients. Partner sexual health is also a huge social barrier. So if your partner is having pain, it's going to impact your ability to enjoy sexual activity with them. If your partner is having arousal challenges, that is also going to impact your ability to stay present and engaged with that person. And so, one of the conferences I went to recently talked about how treating one partner, even without doing anything to the other partner, can actually help their sexual life as well. So, it's really important to make sure both partners or multiple partners within a polycule are being served well as we age. Okay, so we talked about barriers. Now let's talk about what can we do. So in sex counseling, some of the things that we're going to do are work through strategies for partner connection. And so establishing some of those connections can help to overcome some of those barriers that we talked about. We're also going to talk about ways for you to discover your erotic self and also your erotic self today. We're going to try to do our best to break through some of those harmful sexual scripts. And we're going to learn how to cultivate different types of desire. I think we think about one type of desire, but the reality is there are many and they can all be cultivated, which is sort of fun. And then from a pelvic PT perspective, we can certainly do pelvic floor exercises for coordination and strength. So the pelvic floor is super important for blood flow during arousal for any genital orientation. It's also part of the things that rhythmically contract during orgasm. And we know that for folks that have a hard time lengthening or softening or relaxing their pelvic floor, that can lead to pain with insertion. We can also do things like manual therapy or dry needling specifically works really well for improving blood flow as well as nerve response. So if you want to improve sensation in your erectile tissue, dry needling to some of those pelvic nerves can be really helpful. We also talked a lot about how blood flow can impact this, whether that's through a medical condition or inactivity. Doing exercises to help with mobility, help with your strength, and even just overall blood flow can be really helpful for your sexual life and sexual activity. The other thing we want to think about is considering this period of time like a new adolescence. So, if you can recall the adolescence when you were a child, so you're coming into your sexual debut, you don't really understand where your parts are oriented. These all feel really different, not sure what to do with them, not sure how they go together, not sure what feels good for me. This feels a little overwhelming. This feels a little weird. It's a little awkward at first, but then slowly kind of figure it out. And so your body is different at every stage of life. And so it's kind of like discovering your body anew each time. And so instead of thinking of things like, oh gosh, it's not the way it used to be, like it's a loss, this is instead an opportunity to really be creative and curious and learn what feels good now. And then you can carry that skill into each subsequent decade as things continue to change, as they will. So, some of the things that you can do in this new adolescence period are broadening your sexual menu. I love to talk through strategies for people to think about sex in different ways, think about different acts and actions, different ways to interact with themselves and with partners. We're going to talk about external play options for everybody. And so maybe the primary of your sexual life has been penis and vagina insertion. And you, as a vagina owner, may not have used any kind of external stimulation or not explored it to a sufficient degree. Sensory play is another great way to explore some things. And so that can be a way to bring some new feelings and new explorations of different body parts, and can also be a way to help with some attentional and focus issues. If you are a person who has never experienced internal play, so potentially a person with a penis and a prostate, you might be interested in trying some prostate play. That's a really good way to increase pleasure and have a different experience of pleasure. But in addition, it can also help with some stimulation for maintaining a penile erection. And just as a PSA, erectile rigidity is not needed for a good time. Either solo or partnered, you can actually have an orgasm with a completely flaccid penis. And I also want to shout out Dr. Barry McCarthy. And so if you want to look up some stuff from Dr. McCarthy, um, he has some stuff, I think, I know I've seen videos on YouTube and on the AARP website. I think he has a book or two out. And his model is called Good Enough Sex as We Age. And so what that means is you want to try to take today as unique and not comparing yourself to your past self. So we're going to be good and we're going to feel enough in the type of sex that we're having now. And life has changed. We can't expect to do what we've done before. And this can be an opportunity to have the best sex that you've ever had because you're curious, you're experimental, and you're trying new things you haven't done before. And that can be a helpful thing about not having a particular sexual script, is that you can discover something you didn't know was really something you like. Another suggestion I have is to take your time. Everything about physiology as we age is telling you that you need to slow down. So think about sports or athletics or exercise and how your warm-up needs change with each decade. So you really need to spend a little more time getting things going to feel that blood flow, to get movement. You maybe need to do a few more mobility exercises than you used to. And I don't know why we expect anything different from our genitals. So our genitals require more time to get going. They require more mobility in the joints and the back and the hips and everything like that to make yourself more comfortable. I'm also going to encourage you to block time in your schedule. I've joked with clients often that I think that, retirement age correlates with some of these sexual challenges with aging because you need to have more time to have sex. So when you're not working all day long, you can have more time to play around with some of these things. And also take time to transition into and out of sex. So if potentially lots of responsibilities and stress is a challenge for you, give yourself a buffer of transition time before you try to hop into a sexual encounter, and then give yourself some time to transition back so that you have this nice protected bubble of time around having sex. And use sexual aids. I love sexual aids. My favorite are vibrators. And so we know that for vulva owners, your receptors for vibration degrade slower than the light touch receptors in the vulva. So you can use a vibrator for pleasure long after your hands don't feel good anymore. It can also help with more constant stimulation for erections. And there are a lot of really great vibrating devices that are rings or both ring and a vibrator, or you can use whatever kind of vibrator with a partner. So it's for vulva and penis owners. You can also use vibrators for prostate stimulation. Again, a different sensation, a different opportunity for pleasure, and a good way to help maintain some blood flow in the area. Lube. I would love to have 75 exclamation points here. So lube is not just for internal play. It is great for external stuff too, because we know everybody's skin changes with aging. So even when you're doing things externally, lube it up, have fun. You can also use constriction rings if you're a person with a penis. So that helps to prevent backflow of blood and helps you maintain a more rigid erection. You can have these that vibrate, you can have these that are adjustable, or you can have them that are sized specifically for you. Lots of options there. You can utilize a vacuum erection device if you're interested in having some help for erectile issues. And this is something we recommend to our post-prostatectomy guys. You can also triage with your prescribing provider about medications. So medications can be really helpful for some of these physical issues. So getting vaginal estrogen can be a wonderful addition for any of those genitourinary symptoms of menopause. There are a lot of other great hormonal interventions from other providers, and this is true for all genders. You can use a PDE5 inhibitor, so that's Viagra or Cialis, and actually all genders can use that. So Cialis can also be used by people with clitorises. You can also potentially, if you're a person with a penis, do an injectable to help give some blood flow immediately to the penis and dilate some of those vessels. And if you're a person who has other orthopedic pain that is limiting your ability to engage sexually, try to take some pain meds a couple hours before sex, and that gives you an opportunity to, um, feel a little bit better in your body so you can just focus on what feels good. All right, so now I guess we'll open it up for anybody who has any questions. And if you have questions beyond this, of course, you can schedule a PT and or a sex counseling visit, and we can work through this together.
I did have someone email, you kind of went over it a little bit, but someone had a question about what actually is like Cialis and Viagra.
Oh, yeah, that's a great question. So they work in slightly different ways. So what they do is, so Viagra inhibits the inhibitor of an erection. So that means when you take Viagra, it inhibits the thing that prevents you from getting an erection, making it more easy to get one. Cialis is similar in that it helps with dilating blood vessels, but it kind of lives in the system to make the conditions favorable for getting an erection. And again, one of the conferences that I was at a couple weeks ago talked about even using a topical Cialis on the clitoris of people who have arousal dysfunction. And so I had not heard of that. So that's an off-label use potentially if you're seeing a sexual medicine physician. But lots of really wonderful uses for that. I also want to say that taking medication, in my experience working with clients, particularly with erectile difficulties, is not a panacea because, erections are pretty complicated. So it's not just a physical response. Sometimes even with use of one of those, relational issues or stressors or other performance related factors can make it challenging. So lots of other things to do, but that's a little bit about those medications.
Well, thank you.
Mhm.
We also just got another question about if you had any specific brands of vibrators that you would recommend.
Oh, do I ever? Uh, I think it's on YouTube, right? The one we did with vibrators.
Yeah, I think so. If not, I can definitely put it up there.
Okay. So see our YouTube page because I think one of my more recent bedroom banters was about vibrators. So it kind of depends on what you're looking for. So there are a lot of different vibrators for different needs. I've been working a little bit more with this company called Mystery Vibe, which I think has some really elegant design of vibrators for all different needs and for all genders of folks. Um, I don't think vibrators have to be super expensive either. So, Unbound Babes usually has a great selection of more inexpensive vibrators. And I always want to shout out our local sex toy shop, which is called Kiss and Ride. So if you're interested in looking at vibrators, you can go to Kiss and Ride. It's in Little Five Points. And Sarah can answer any questions for you. You can actually put your hands on the devices and see if these are things that work well for you. So I think some of the things you want to look for is, does the type of vibration vibe well with you? Not to use pun, but is it too much? Is it too intense? Is it too light? Is it too much variable? All those different kinds of things. But there's so many different types of vibrators. And if you have more specific questions, shoot me a message.
If you are a current patient or not a current patient, coming in for a sex counseling session is always super beneficial as well, just so she can personalize all of the information that she gives you.
Yeah, I think that's accurate. So I think that curiosity is really the thing that I'll leave you with as far as having a healthy, happy sexual life with aging is just really wanting to be curious about that. And so I really, this is one of my favorite things to work with is helping folks in their 50s, 60s, and beyond having the kind of sex life that they want for as long as they want to. Because I think people should still be having sex if they want to until they die. So